Hi, everybody. Welcome to the UEA Nursing Podcast. My name is Joe Ellis-Gage, and today we have a Meet the Lecturer episode with Helen. Hi, Helen.
Morning, Joe.
So we're going to find out a little bit about you this morning and sort of explore your career and how you got to be here. But just as a really brief introduction, just tell us who you are and what your role is here.
So my name's Helen Humphrey. I'm a Children and Young People's Lecturer here at the UEA, and I'm Practice Education Lead for Children and Young People's Nursing.
Excellent. Okay. We'll explore what that means later on.
Yeah.
But to start with, we're going to try and find out how you got to this point. So let's start with why did you become a nurse?
Yeah. I didn't always want to. I wanted to be a forensic pathologist.
Okay.
I liked Silent Witness. I like gore. So, forensic pathologist, it's a long training.
Yeah.
So here I am, a Children and Young People's nurse.
Next best thing.
18 years. Yeah.
So you enjoyed Silent Witness.
Yeah.
You thought, that's what I'm going to do. Then went, actually, seems like a bit of a long trek to get to that point. I'll go for children's nursing as the next step. I'm not sure everyone would see that as the logical next step.
I know. To be fair, I really liked working with children and young people. I did a lot of volunteering and stuff during high school, and so I think nursing. There was always probably a thought about nursing if I didn't want to be.
That was like a backup plan to forensic pathologist.
Pathology.
Okay. So not as weird as it first sounds then to sort of go into it. And whereabouts did you do your training?
I did my training at the University of Hertfordshire with Michaela, who I know
who was on a couple of weeks ago
on the podcast. So we did our training together. I really enjoyed my training. It was.
Were you in the same cohort as Michaela?
Yeah, I was.
Okay.
Yeah, and it's really odd. I've worked with other people who I trained with, not just Michaela. So, really liked my training. Really diverse experiences.
Okay, and you did. So when thinking about those sort of diverse experiences, what sort of placements did you do that were different to the norm?
Yeah, I think my favourite placement was in a secure CYP mental health facility. Okay. Because it was completely different to my other placements, to anything I'd really experienced. And now we very much, we focus on physical and mental health being one. But, I think when we did our training, it was very
distinct.
separate.
Yeah.
And so it was really, I think, a valuable experience, especially working with adolescents who, had some real challenges. So I think
That's
I
interesting.
really enjoyed that experience.
Yeah, because when we did, actually, that would have been quite rare at that point to get that much exposure to children and young people's nurse, because we didn't have any placements related to that at all, and probably barely saw any patients who were kind of classed as having mental health conditions. Throughout our whole 3 years, like those people were there, but we didn't really have that exposure to it. So it's quite an interesting place to be able to go to.
Yeah, really interesting. I don't think there were many in my cohort who had placements like that.
Yeah.
But I'm really glad. I think it made a difference to my practice.
And everyone's pathways are always different, aren't they? It's always like you can't always compare your pathway to your friends. You always do different things, and even if you do the same placement, you get different experiences anyway.
Exactly, and it's the same that if you have a placement and before the placement you think, I really don't. This isn't going to be for me. It's just having that open mind that actually, even if you think at the end of it, this is not for me, there's still a lot to learn and a lot to gain from that experience. So, I think that there's always a placement you think, oh, really don't think this is going to be for me, but, take every opportunity.
Yeah. I remember when I did mine, the one I was not looking forward to was the health visitor community kind of training. And that placement, because I thought, oh, it's not going to be me, is it? I'm not going to be a health visitor. And it was really interesting placement. Really enjoyed it. My supervisor, mentor, whatever we called them at the time, was like excellent. And I did it, and I finished and went, well, I know I'm never going to go and work there because it was not for me. But there's little bits that I still remember from learning from that are still really valuable now. I remember probably 5 years later, like 3 a.m, having a woman arrive with her newborn baby, like stressed, tired, screaming baby, and basically the baby wasn't feeding. And middle of the night, there wasn't really much support around, and I gave us this sort of feeding advice, and she was like, "Oh, that works," and I was like, "Oh, that is only come from my health visitor placement.
Yeah.
That's where I learned how to do that."
Yeah.
And it's not something I want to be doing every day, but that little bit of knowledge and something like a mental health placement is invaluable because you're going to see that everywhere. And learn things that you don't realise you've even learned.
And exactly, it's those transferable skills, isn't it? That is just by observing the way someone talks to someone within a certain situation or the language that they use. Yeah, invaluable. And I think when you're in that moment, you perhaps don't realise how valuable it is.
Yeah. Yeah. And actually you learn from seeing things done really well and seeing things done not so well. So you might have a placement where you even think, oh, not only am I not interested in this, I don't even feel like I'm seeing best practice. But you're still going to learn. Yeah. And probably learn even more because you're going to go, right, well, I'm not doing that, or I am doing that because that was done really well, but that one, maybe not. Yeah.
Definitely.
Okay. So really interesting placements. Enjoyed your training, kind of knew it was definitely for you, like it wasn't a...
Yeah, I was a geek. Let's say that.
So you got properly into it and made the most of it.
Oh, yeah.
Very good. I wasn't. Didn't suddenly go halfway through and think, silent witness is calling me. I've made the wrong choice.
No,
you're happy.
Yeah.
Good.
Loved it.
Okay. So what did you do after you qualified?
So I went to work in a regional tertiary centre on a busy, it was a really busy, fast-paced, lots of high dependency, lots of specialist surgery, plastics, orthopaedics. And although it was fast-paced, it was really busy. I think, it was a big learning curve because I think for your first job when you're newly qualified, that's challenging. But yeah, I really loved it, and I can go back into that trust now within my academic role and still see people that I worked with working there. So it's really nice that there's that continuity.
So it sounds like in at the deep end for your first job.
Definitely, yeah.
But you responded all right to that.
Yeah, I like a challenge.
Okay, and that was still away from home at that point. So because your kind of family were in Norfolk.
Yeah.
But you were still working away at that point.
Yeah, so I lived on site when I worked there when I was first newly qualified, which also is a challenge, isn't it? I think some people may think I want to go nearer home so I can live at home. But I think, that was a good choice, I think, for me.
And actually, we get a lot of people who feel like they're going to move home at the end of their training and then don't. Yeah. Because they go, actually, I'd like to still work at this trust or I've got friends in this area or whatever. And then you go through that transition away from living at home straight after you finish. Yeah. Okay. And then you did move back to Norfolk.
I did move back to Norfolk, yeah. So I worked in one of our local trusts, initially as a staff nurse and then as a deputy sister, which is where we originally met, Joe, all those years ago. Yeah,
back when I was I'd have been about, newly qualified staff nurse pretty much at that same point once you were moving back, I'd have thought, because you're a couple of years ahead of me when you trained.
Yeah. So
not because you're a couple of years ahead of me in age, just because I trained a little bit later. Just for putting that on the record.
Thank you for clarifying that, Joe. So I worked as a staff nurse and then deputy sister, and I really liked the fast pace areas within paediatrics.
And you just moved you were a little bit all over the place in paediatrics.
Yeah. And I'm one of those people that I like a challenge. I don't really mind where I work. So I did often rotate around where I was needed.
Yeah.
And had the opportunity to do lots of CPD and, HDU module, oncology modules. Really.
So actually, one of the benefits of working in a trust that isn't as specialist, so often when you go to Great Ormond Street or go somewhere like that, you end up in quite a specialist role, which is great.
Yeah.
But actually, if you're not quite sure where you want to go, or you just starting out, working in a trust that lets you do a little bit of everything, and you can start dip your toe into different areas and see what you like, see what you don't.
And that changes, I think, throughout your career, and that's the good thing. There's such diversity to what children, young people's nurses can do, where we can work. Yeah.
So you built up all these sort of skills. You did a little bit of everything, and then you thought, right, I do actually want to go down a slightly more specialist route.
Yeah.
What did you do next?
So I was a clinical nurse specialist in a children, young people's palliative care service. So really autonomous. It was a nurse-led service. Didn't have any medics. Did my advanced clinical assessment course, and it really was again quite fast-paced, autonomous.
Yeah.
But I really enjoyed that, using your advanced clinical skills. Actually as a nurse, making safe rationales for patient care, and it was great.
And you basically could get really stuck in and lead on what you were doing.
And actually there's this thankfully it has changed, but there has been this hierarchical kind of nurses sit under medics, but actually it's not like that. And, as a clinical nurse specialist working in a palliative care team, I was often talking to medics who had very little experience in what is a niche area. Yeah. And so, as we've both experienced in our careers, as you progress and you develop that experience, medics do ask you. And that's how it should be.
It goes both ways, doesn't it? You kind of complementary sort of roles.
Yeah, exactly.
And you can't really have, a lot of the time, they're not interchangeable. They are different, distinct positions, but they work well together.
Exactly. And medics are not there to be scared of.
No. Someone said to me the other day, a few months ago, at an open day, there was a young person looking around who was interested in doing the course. And the dad who was with her, at the end, she was asking about what she would do and how placements would work and that kind of stuff. And he said at the end, so, but I guess there's always a consultant on standby to tell you what to do if she needs it. And I just laughed and went, there might always be a consultant by, so you can tell them what to do if you want. And she looked absolutely terrified, and I was like, it's not how it works anymore.
No, and we are incredibly skilled, knowledgeable professionals, and we need to share that experience. So thankfully things have changed.
Moving away from that now. And I guess the other thing that you'd learn in that role, other than like very clinical specific assessment type things and treatments options and all of that, is actually just really, really good communication skills, family based care skills, because you're caring for a young person, but you're never just caring for that one person, you're caring for the whole family.
And exactly that, that is that is the challenge, but the privilege that children and young people's nursing gives us, isn't it? That actually we are not just caring for the child or young person, we're actually caring for the family as well, and that brings you an extra dynamic. And definitely when you're going into people's homes, you know, especially when their child is dying, yeah, you know, those challenging conversations that you need to have, it taught me a lot.
Yeah.
And so from that perspective, really valuable. And I suppose within my role here at the university, I really enjoy having those discussions and sharing knowledge with students about actually to not be afraid of having challenging conversations, but actually being professionally curious is really important. You know, we're not just there to do a task.
Yes. And we can get quite task focused because there's always a list of jobs that need doing.
Yeah.
And as students, there's a list of tasks to sign off on the proficiency documents. Yeah. And it's all, everyone gets very focused on the physical hands-on skills, but all of that other stuff is just as important or more important, really.
Definitely. And rightly, you said, you know, that focus on venipuncture and cannulation, whatever else. But actually, if you can't prepare that child to have a cannula put in, you know, that's going to be incredibly difficult. So, yeah, definitely, those core communication skills are essential.
Yeah. So then you did that for a while, and then you came here.
Yeah. So I did some work here as an associate tutor, really enjoyed teaching. I think I had always loved supervising and assessing students throughout my career. So it kind of felt like a natural progression. Part of my clinical nurse specialist role was a lot of also teaching staff. So, it's a funny story, really, because I didn't get the job initially.
Okay. So you went for the job and they said no.
Yeah. So I can remember vividly, it was quite late on a Friday evening, and one of the senior team rang, and I think the person that had been offered the post and accepted had subsequently had to decline. So, they offered me the post, and here I am.
Take the opportunity when you can get it, and here you go.
Yeah, and that's the thing, isn't it? You know, life doesn't always work out the way you think it's going to, and not everything goes right. But I suppose I'm a firm believer that everything happens for a reason.
Yeah.
And, you know, jobs, career opportunities, you've got to take the opportunities when they come your way.
Yeah.
So
good. And then here you are.
Yeah.
So one kind of quick bit just more to ask about. So alongside the teaching and the assessing and the marking and the planning and the student support and the link lecturing and all of the other stuff that we do, you are also practice education lead for children and young people's nursing.
Yeah.
What does that mean? What do you do?
So part of my role is, I mean, we're very lucky. We know our children and young people's nursing students really well. We get to know them. So I will plan their placements across the 3 years of the programme, develop relationships with new, perhaps practice partners, because, you know, thankfully, the idea that actually children's nurses only work in hospitals on children's ward is changing.
Yeah.
But there's so much diverse opportunity. So it's trying to give students during the programme that diversity. And I really like going out and seeing students out in practice, you know, and not even necessarily if they've got any issues, but just to see how they're getting on. Because, you know, that there is that transition from university into placement. and also getting involved in those prep for practice sessions in preparing our students. And then also lots of kind of the policy development, working within academic networks with our colleagues at other HEIs. So yeah, quite busy.
So it's quite a varied kind of role between stuff the students might see, like being the involvement in their placements and contacting them and support and prep and all of that.
Yeah.
But also the back office stuff, the building up relationships with other areas and the policies, the organisation, all of that stuff to keep everything working.
Yeah, which I also really enjoy. I like going out into, and I think post-COVID it's so nice to go out and see people face to face, and so I really do enjoy the role.
Good. And then so final question, if you were going to be giving a student of any year group, maybe their first placement, might be their last placement, a bit of advice, what would you say is the most important thing for them to think about or do to get the most out of a placement?
Yeah. So take every opportunity that comes your way. Get involved. Don't be afraid to ask questions. No one knows everything about everything. Doesn't matter how long you've been qualified. So take those opportunities, ask. Professional curiosity is really important. Asking why something is being done a certain way, that's how we learn. So, yeah.
Good. All right. Well, thank you very much. I think we've found out loads about you, found out a little bit about what your role is now, what you've done in the past. So that'll be interesting to students. Hopefully, those of you that have watched have found this interesting. If you have, please hit the like button, add any comments or questions below, subscribe and you'll get alerts when there are new videos. And have a little look around and explore, because there may be other episodes that you have not yet seen. And thanks again for coming in.
Thanks, Joe.
Cool. Bye.
Bye.